So let us begin with Ellen's keynote study streak, and this must be, I suppose, session number 60 or 62. We haven't manually counted, but we are doing it every day since 11th of June 2024. Sometimes 4 remedies, 5 remedies, sometimes 2 or 1 remedy. Uh, in relation to the previous remedy that we have discussed, we started with abrotenum and found a relation between different remedies and studied them in groups. Today we'll study a gastric remedy, and day before yesterday, we had studied podophyllum and some more gastric remedies in the last week, which was Aesculus and the Elos and all those remedies. So last was podophyllum. Now let us go on to croton tick, one of the very useful remedies that you will need in your practice for various types of cases, especially those who have been reporting to you with gastric distress or diarrhea after few hours of ingestion of food which is prepared at weddings or festivities, etc., etc. Let us study how does it affect the body. So number one is that the first line of Ellen's keynotes is of the prime importance, and it reads that croton tick affects the mucous membrane of the intestinal tract, producing transsudations of watery portions of the blood, a copious watery diarrhea. Now, when you understand this from the physiological point of view, it will mean a lot of things when you will break it down in different portions. And what does it mean? The blood has water component and the corpuscles, and the water component from the blood is kind of pulled out. And if you see that this medicine is prepared from croton oil seeds, this is the most commonest used oil across the Indian continent, at least, or the Asian continent, for preparing food. And it affects the body when the proportion is in excess quantity or it is decomposed in a way by keeping the food for a long time. So this medicine croton tick will be useful in such cases where there is copious watery diarrhea because of the exudation of the water component from the blood corpuscles, from the blood especially, and the bowel are as if moved by spasmodic jerks. So you will have someone telling you that I had diarrhea 1 or 2 episodes, but it was so powerful, as if in a gush of fluid falling from the anal region into the closet, and it caused a big bang or boom. This is what croton tick will be describing you. There will not be multiple stools, even if they will be of small quantity, but one big stool of enormous quantity is going to be what is going to belong to croton tick prescriptions. So you see that there is croton tick for diarrhea which comes out like a shot. Also, the other remedy is gambogia. As soon as the patient eats, drinks, or even while eating. So there will be cases where patients will tell you that we were having some meal at the festivity organized by so and so family members, and suddenly there was a gurgling in the stomach and we had to rush to the closet to pass the stool. It passed like lot of explosions. That is croton tick for your understanding. It will be also having yellow watery stool, and the patient will complain that it came like a gunshot. There will be cases where there will be irritable bowel syndrome. There will be patients, especially children, who will have this phase of passing the stool in between while they are eating. If it is of this nature where it passes like a gunshot or like a boom, think of croton tick in those cases. In irritable bowel syndrome, you will need to give medicines like these at smaller intervals to minimize the spasmodic action of the anal region. That is what you can see. The line mentioned, the bowels are moved as if by spasmodic jerks. So there is a kind of a peristaltic action which is hyper stimulated due to the contents present in the intestinal canal. That is where the croton tick will work. And in irritable bowel syndrome, in cases of diarrhea where it is expelled in a gunshot, in a lot of force, you will need to prescribe croton tig for such patients. There will be constant urging to stool followed by sudden evacuation which is shot out of the rectum. Again and again you will see the same line mentioned. Gambogia, Gratiola, Podophyllum and Thuja have these similar prescriptions, but there is little bit of difference in Allosocotrina and croton tig, which you will read in the next line. Swashing sensation in the intestines as of water before the stool. Now there is a mention that there is a rumbling sensation before the stool in allos and swashing sensation before the stools in croton tig. For the patient it will not mean anything different, but what will be different is that sometimes the patient has to hurry too frequently and too suddenly, and there will be passage of flatus at times and little bit of stool. That will be allos. But if there is lot of stool which passes in a big junk, big quantity at once, then croton tig is to be indicated. If you understand this concept, prescription for your diarrhea cases becomes very easy. Next you have is croton tig for respiratory system. Cough as soon as the patient's head touches the pillow. A spasmodic cough sets in. Suffocated, must walk about in the room or sleep in the chair. So in the first paragraph in the gastrointestinal system we read that there was spasmodic movement of the intestines. Now you have in the respiratory system spasmodic movement of the respiratory tract for the cough paroxysm. The patient is suffocated, has to walk about or sleep in the chair. He cannot lie down. That will be the similarity which you will have for croton tig with Drosera also. Drawing pain through the chest. Now the next is the female reproductive system. Drawing pain through the chest from the breast and to the scapula of the same side every time the child nurses and nipples are very sore. One of the few remedies that works beautifully on the gastrointestinal tract, respiratory tract and also the female mammae. The croton tig is going to do wonders for you on 3 levels, as well as on the skin, which is the next line. In all cases where there is lot of tinea cruris symptoms or jock itch, which is normally called by patients in lay language, there will be lot of intense itching and the skin is so tender that he is unable to scratch. Croton tig will come of use. You can give it as an intercurrent or a remedy in between required for such patients. Patient feels better by gentle rubbing, but he cannot scratch it too harsh because the skin is very tender. And there is also patients who will tell you that there is eczema all over the body and I just rub it gently so that I feel better. Don't think of phosphorus, don't think of remedies which feel better by rubbing, magnetism ameliorate. If skin symptoms are strong and if you find this rubbing, croton tig should be given a thought. It will maybe push the patient towards the direction of cure, if not cure. Intense itching of the genitals of both the sexes, Rush Tox is very close remedy. So all those patients where you are giving jock itch, if you are struggling with curing them, Rush Tox will be one of the medicines. Tarantula cubensis will be one of the medicines. Croton tig will be one of the medicines. Rus venenata will be one of the medicines, and these medicines should be given frequently in 30 potency every 3 times a day, 4 times a day, with the intermittent doses, intercurrent doses of medorinum or sulfur or sorinum depending upon the patient's miasmatic background. Then you will be able to cure jock itch. Otherwise you will forever continue, palliating them, and they are not going to cure. And the same thing, the dermatologist will, miraculously palliate them, relieve them for few months by his ointments, which the patients do require at that moment. So croton tick should be thought in cases where there is intense itching of genitals of both the sexes, vesicular eruptions. There will be eruptions which, if you have studied pathology very well, there is macule, papule, pustule, vesicles. There are some medicines that will work extensively and specifically on the nature of eruptions, like the Juglans medicines. These medicines, Juglans regia, Juglans cinerea, they will work on the cases which have macules and papules. There are some medicines which will work on the vesicular eruptions, like the remedy Entimtat, Ranunculus bulbosus, Rus tox, Rus venenata, again croton tick. So once you have that definition done from the pathological point of view, your prescription becomes easier once you see the skin patient, and that is what you need to do in all the different skin types of skin cases. You need to categorize them based upon their nature of symptoms, their presentation of skin, whether it is raw, whether it is dry, whether it is wet, and whether it has different sorts of eruptions. Then you will be able to cure such patients with much ease. The patient who will require croton tick develops also an acute eczema all over the body, which the other remedy mentioned over here is Rus tox. So there is an alternation of or combination of eczema with the vesicular eruptions, and the body or the skin is very sensitive as if it is raw, and cannot itch because the patient feels that the skin is very tender, very thin, and he gently rubs the part so that he feels better. In such cases, croton tick is bound to give you good results. You should attempt to give it in low potencies with frequent repetitions, and you will get the results. Next we come to is the modalities of croton tick. Diarrhea from every motion after drinking, while eating or nursing. Argentum nitricum, arsenic are very close. You will need to differentiate based upon the modalities if there are any ailments from mind, anticipations, or it is gastric related. In such cases, argentum nitricum will work. If not, then croton tick is your go-to remedy. During summer, you will have an aggravation for croton tick. From fruit, from sweets, there is aggravation from croton tick. So all those cases in summer, when there are festivities, when they are having food, especially in seasons of Holi, and also in summers when there are some weddings which go on, or the weather has turned hot and the wedding is there, and there is a lot of food prepared which is kept for a long time. Some people are consuming it, some people are very sensitive, they come down with some gastric symptoms. In such cases, you can think of croton tick, especially when it is mentioned that it is aggravation from during summer, from fruits and from sweet meats. So all these patients who will have sweets or sweet related things, they can also be given this medicine croton tick if they develop gastric symptoms. Least food or drink will cause issues to croton tick. Cambogia is one of the very closest remedies in such modalities. And next we have is comparison. The remedy croton tick is compared with calibrom and phosphorus. Phosphorus especially for chronic infantile diarrhea. In fact, phosphorus I have given very frequently if patients have suffered from loose stools which keep on going for days and weeks, and they don't kind of tell you that there is diarrhea, but it's a loose stool, not properly formed, but just flows through the body like 2 or 3 times a day. In those cases, phosphorus will help as a chronic constitutional medicine. Croton tick, although, will work for more acute pathologies or cases. Silicea is similar to croton tick for pain from the nipple through to back when the child is nursing the mother. So that was about croton tick. We are discussing the gastric remedies in the last 4-5 days. And we have discussed Aesculus, we have discussed aloes, podophyllum, and other gastric remedies, colinsomnia as well. Now let us discuss one more short remedy, which is dioscorea, one of the very important remedies you will be needing to prescribe in patients who are having addiction to tea. So all those cases where you feel that there is addiction to tea and you can't do anything, give them a dose or two of dioscorea, especially that gastric system will be toned. Don't give them thiachinesis. It's not always that thea will work. You may need to give them this medicine, which is dioscorea. Let us read the first line which Ellen mentions for dioscorea is persons of feeble digestive powers, old or young, flatulence after meals. So all those patients will tell you that there is lot of gas which develops as soon as I have my meals. Think of dioscorea as an intercurrent medicine to tone their stomach. Tell them to reduce the tea, and the effects of the tea will wear out once you give this dioscorea medicine in extremely low potency like 6, 12 or 30 once a week, or once in 15 days with your constitutional medicine running in the background. So you have flatulent colic or flatulence after meals or after eating, especially of tea drinkers who are often subject to violent colic. So someone will come and tell you that every 15 days I am having lot of gas which keeps on developing and I don't know what to do. I just keep on taking some Ayurvedic pills which come for releasing these gas, or I keep on drinking a lot of water but still the feeling is not good. I keep on taking 7 to 8 cups of tea per day. Think of dioscorea in such cases. Give them intermittently with the chronic treatment if they are under chronic treatment, and you will definitely find some good result in the improvement of the patient, because their gastric system has slowed down their entire body, which is very important to bring in line. Next you have for dioscorea is griping pain in the abdomen about the umbilicus, violent and twisting colic occurring in regular paroxysms as if the intestines were grasped or twisted by a powerful hand. So many times patients will tell you that no, there is no rumbling as such, but I feel it's kind of a twisting. This sensation in dioscorea is very strong. You will find many patients again and again telling. So in all my previous sessions I have been telling that patients will not come and tell you that there are a lot of sensations, but they will give you more emphasis on physical particulars, especially modalities. But there are few remedies whose sensations will be very much evident. Dioscorea is one of them, where the patient will tell you that there is a pain which is, and they will give you this expression that the pain is kind of twisting or grasping my abdomen. I feel it is wringing as if you wring the clothes. That will be the expression in the very first few hours only of the development of dioscorea case. Think of dioscorea highest potency if these sensations are present, and you will definitely get good result. Colic pains which are aggravated from bending forward. So along with these type of sensations, you will also have patients who are again and again stretching themselves while they are describing their complaint. Even without asking them their modalities, you will get access to prescribing dioscorea because they are stretching these ways. So there are few components in our materia medica, in our repertories, which will be your observations, and these observations once strengthened over a period of time, you will need not even ask them. You can just confirm from them definitely, but even without asking, you can confirm with them in different aspects about how they feel, when is the pain more, how do they feel better, and you will get access to prescribing dioscorea with easy understanding from the patient's words. Dioscorea has aggravation from bending forward. They would probably be much upright in their case presentation, and also they will tell you that I also cannot lie down because it causes a lot of problem. I feel better if I'm standing or even if I'm stretched backwards. This is exactly the reverse of the popular remedy that we all homeopaths give, that is colocin. So next is male sexual system. Dioscorea is one of the few remedies that acts on the gastric system also and the male reproductive system also, especially where there are emissions during sleep. Vivid dreams of women all night, like the remedy Staphylos agria. The knees are weak, genitals are cold, great despondency, sadness is there. Again, the remedy Staphylos agria is involved. Patient feels guilt after doing the acts of masturbation. Staphylos agria is very strong. Another remedy you can think of is Dioscorea. Next is for skin. Dioscorea is one of the very good remedies when the complaints of phelons are there in the nails or the fingers. When the pains are sharp, agonizing, and they radiate from one part to the other parts of the body, or it kind of involves the entire nerve which is running through the entire part of that affected organ or affected finger, and the pains are sharp, agonizing when pricking is first felt, and the nails are also very brittle in nature. Disposition to paronychia. So we have seen that there are remedies we give for prescribing patients for recurrent disposition to boils, recurrent disposition to skin problems. But there will be some patients who will always develop these infections in the nail bed, whether it is of major what do you say, major impact or lesser impact, or smaller impact or lesser symptoms. This remedy Dioscorea is going to remove the disposition to cause this nail bed infections, just like the remedy Heparsol, which is also closest to Dioscorea. You can compare Dioscorea with, and of course differentiate with, colocynth, podophyllum, and the other three different polycrests given are phosphorus, silicia, and rust ox. Aggravation for Dioscorea is from bending double or from sitting. They feel better by stretching out or standing erect or even motion. One of the other remedies which I prescribe in patients who have gastric trouble but feel better by motion is China officinalis. So you can go to Boric and read about China officinalis in the stomach. The last line given is bloatedness, better by movement. So Dioscorea and China are the two top remedies in such cases where they feel better by motion in such gastric distresses. You can see that the patient is so much tired, but still he needs to walk because he feels so better. The mind is diverted or the nerves are felt better in such cases. So we come to an end with two remedies today. Croton take one of the remedies and another remedy is Dioscorea. Uh, if you are enjoying this Ellen's Keynote study streak, do mention in the comments below about your experiences, and I would be more than happy to come out with more better content if you stay tuned with all the activities that I am pursuing for the benefit of all homeopaths. So Dr. Sanawar Ali, constant hiccup. One of the very toughest challenges for a homeopath is to tackle constant hiccup. And if you want to understand how to treat it, you need to understand the nature of the problem. One of the things is that there is spasm of the gastroesophageal end of the nerves or the mucous membranes. So the first remedy that you should think of is MACFOS 6x or 12x. You can give in water and tell the patient to take, in warm water especially, tell the patient to take every 15 minutes if it is too frequent, or 1 or 2 spoons, or tell them to take every half hourly or 1 hourly depending upon the intensity of the complaints. Next remedy you can think of is Nux vomica. Next remedy you can think of is also Ipecac. If there are any concomitant symptoms, you can think of tabacum. If there is cold sweat or cold forehead, or you can think of even veratrum as a remedy. So pain shifting bilateral side of arms. So then you can think of diasporia, which is what we are discussing today. Uh, some remedies we should be understood from the you know from the nature of their expression of complaints. So that is what I would like to answer Dr. Sanawar Ali on Instagram. On YouTube, Dr. Shailesh Kumar, some content also from Boric Materia Medica. Once I appreciate your valuable question. Once I finish with Alan's keynotes, I would definitely be doing the Boric Materia Medica and other books which are very essential for all homeopaths, and how you will understand, how will you practice in your clinic. But most importantly, once I finish Alan's keynotes, there will be a session for everyone. If you wish to join, uh, on how you will clinically use Allen's keynotes in practice, how will you find out what components to be used to prescribe in clinical practice. It is going to be a wonderful treat for everyone. It's just a matter of few days. Once I finish Allen's keynotes, the entire study streak, we will proceed to the next step of understanding how practical applicability of Allen's keynotes should be there. How will you study Allen's keynotes? And that's what would help more number of homeopaths to continue with this path of homeopathy. So Dr. Sanawar Ali, you can definitely, yeah, your suggestion is welcome for Boric Materia Medica and NASH. Definitely, I'll keep that noted, and we will take that up once we finish these sessions. So stay tuned, and there are some nice activities coming up very soon for all homeopaths, and nice sessions which you can attend free of cost, or if you wish to avail it with your if you want to excel, there are some paid sessions which are exclusive. You can contact the WhatsApp number which is provided in our profile, or email to me. The email address is provided in all the posts which we are sharing. So thank you all for joining, and see you all soon in the next session, which is tomorrow evening with the next set of remedies.